And now we talk to Dr. Marie Rosete-Liquete. She is the Executive Director of NKTI. Good morning, Doctor. Thank you for taking our call.
Good morning. Yes.
Doctora, how serious is this influx of patients that you are now experiencing at the NKTI? Are you at full capacity and are you able to accept more COVID patients at this time?
Yes, we are. Hello.
Go ahead, ma'am.
Yes, we are at full capacity. And of course, not only with the COVID patients, but we had an influx of leptospirosis. Remember we had the flood the past week. So we also have the leptospirosis in our emergency room, in our hospitals.
So are you able
And right
to...
now, we have 42 leptospirosis admitted in the hospital.
Are you able to accept more patients at this time, ma'am, whether for COVID or other illnesses?
At this point in time, if they come to the emergency room, of course we have to accept them in the emergency room and give them the proper management. But they should not expect that they can easily be brought up in the proper room. You know, we have the tent also full. So that is the dilemma now. We cannot just add tent, and all. Especially, you know, the tent is not comfortable. You're not comfortable there. Okay. But if they come to the hospital, of course, we try to take care of them. Yes. Mm-hmm.
So, ma'am, how would you compare the situation now to the previous surge in cases we had? So, for example, last year we had ECQ twice. Is this situation worse, do you think, especially for your hospital?
It's what we also have leptospirosis. You know, it added up to our cases. And some leptospirosis cases, they need to have dialysis also. So it's not like any disease where you just take care of them, just medicines, medically. But then this another intervention, which is hemodialysis. So they add up to our patients and the length of stay of the patients.
Okay, so you're saying the leptospirosis has sort of compounded this problem of the surge right now.
Yes.
So, ma'am, what is your hospital's contingency plan if more cases do try to come in?
Oh, we just closed a non-COVID ward to be COVID. We closed it, one unit, and then another unit we also converted to COVID. So that's our contingency plan, which we have actually been doing. But because of the surge of the lepto, this is more of the lepto, and also added on to our COVID. Yes.
So at this point, ma'am, could you say na sapat po ho ba ang inyong hospital supplies at personnel?
With supplies, I think we're good at it right now. The personnel, we need additional personnel because a lot of nurses also have resigned for many reasons, you see.
What are those reasons, ma'am?
Well, since you opened up to nurses abroad, so that's one. A lot of them, and we opened also for applicants, but nobody would like to apply at NKTI anymore. We cannot replenish those who have left us already.
I see, ma'am. Now, there's a growing concern about pediatric cases of COVID-19. Are you seeing more young patients in your hospital infected with COVID?
Occasionally, we have pediatric, but I think the Children's Hospital could answer for that. Yes.
All right. But would you know, ma'am, if the pediatric cases, do you see them as more severe or having more moderate symptoms?
I cannot tell exactly about pediatric cases.
All right, ma'am. Now, we're in a 2-week lockdown. Doctora, do you think that that 2-week ECQ is enough for hospitals to be able to recover or at least manage the surge?
Maybe it gives us a little bit of air so that those who are not essentials actually should not be going out. Yes. But anyway, we still continue to have although decreased in number in our outpatient department, because we have to assign nurses also to the COVID. Oh,
Right, I see.
that's-
Okay, so you're saying, ma'am, 2 weeks you think is enough to manage this current surge?
I don't know. I don't know yet.
Yeah, we will have to wait and see. But thank you so much for your time po. We appreciate it. That was Dr. Marie Rosete-Liquete, Executive Director of the National Kidney and Transplant Institute.